Hello everyone, welcome to my channel Ravi Static Physio. So in the series of pharmacology or cardiovascular pharmacology, we are moving further or taking another topic which is central acting alpha agonist. It means it acts directly onto the central nervous system or like into the sympathetic nervous system, which is fear and fight movement. So what is action is to be shown in the fear flight movement, like pupil dilation, increased heart rate, increased GI mortality, increased sweating. So it will be direct acting on that and it will be relieve them. So a medication that reduces sympathetic nervous system activity by stimulating alpha-2 receptors in brainstem. It means it directly acting on the sympathetic nervous system, which is fear and flight movement, and it will be decrease them. So what is there? What ways it is to be bind? Like alpha-2 receptors. Like there is a presynaptic neuron
Hypothalamic
and there
neurons
is
have really
postsynaptic
long
neuron.
axons that carry signals all the way down to the thoracic and lumbar
There is
spinal cord
alpha-2
nuclei,
receptors
where they
are present
synapse
here,
with preganglionic
and the
neuron cell
presynaptic
bodies.
membrane are
Here, they
transferred to
release
the
the neurotransmitter
postsynaptic membrane,
norepinephrine,
which is a
which causes the
neurotransmitter, which is
preganglionic
acetylcholine.
neurons to
It will be
transmit the signals down the
not bind to
relatively
the
short
bind
axon,
into
which
them the
exits the central
acetylcholine,
nervous system
and
via the
central
spinal
acting alpha
cord.
agonist,
These short
which is
nerve
alpha-2
fibers reach the
receptors,
nearby
which is present in
sympathetic
postsynaptic
ganglion,
membrane.
which
There
consists
has
of
to
many
be bind into
postganglionic
them
neuron
and
cell
not
bodies.
after not bind to them to the like
The postganglionic
neurotransmitter,
neurons
which
are
is
also called
acetylcholine.
adrenergic neurons,
So if
because
acetylcholine
they
is
release
not
the
bind,
neurotransmitter
so all the
norepinephrine,
sympathetic
which is also called
activity, which is higher amount is,
and
which is
to a much
present in
lesser
our patient
degree,
body, so
epinephrine
it will be
or
relaxed them.
adrenaline.
So
These two
there is two drugs,
catecholamines activate
which
the
is
adrenergic receptors on many different organs,
and
which allows the
methylodopa.
sympathetic nervous system to
Clonidine
trigger
or
the fight or flight
methylodopa,
response.
these are two
It increases
medications
the
which is
heart rate and
directly
blood
acting the
pressure,
central
as well as
alpha
slowing digestion.
agonist.
All of this maximizes blood
Mechanism
flow
of
to the
action,
muscles
what
in
is
the brain,
the drug
and can
mechanism
help you
action? Like
either run away
stimulates
from a threat
alpha-2
or fight
receptors
it,
in brain
which is why
and
it's called the
decrease the
fight or flight
sympathetic
response.
outflow. Already you have to know like presynaptic and postsynaptic. Already we have
Alright,
aware about
so
that.
let's
What is
zoom
the
into the synapse
systemic
between the
mechanism
hypothalamic neurons
and
and the
what is the effect?
preganglionic
It will be
neurons,
decreased
which can be
heart rate
found throughout
and
the
decreased
brainstem and spinal
peripheral
cord.
resistance.
The
It means
presynaptic terminal
there are too
contains
much
loads
high
of tiny
blood pressure
synaptic
you have been shown
vesicles,
into the body
each of
during the
which stores
parasympathetic
thousands of
hyperactivity.
norepinephrine
It will be
molecules.
reduce them, and
But for
also
norepinephrine to be there in
reduce
the
the
first
peripheral
place, a
resistance
precursor
to
amino acid
slowly or
called
smoothly
tyrosine is
movement of the
taken up
blood
by the
vessel,
adrenergic
blood
neuron
circulatory
and
system
gets
into the
converted
patient
to
body. And now adverse
L-dihydroxyphenylalanine,
effect.
or
If you are
L-DOPA for
taking too
short,
much
by an
medication
enzyme
of
called tyrosine
central acting alpha
hydroxylase.
agonist, so what is
Next,
their side effects?
L-DOPA is
Like
converted by an
sedation,
enzyme
dry
called
mouth,
dopa
rebound,
decarboxylase
hypertension.
to
Sedation, it
dopamine,
means you're feeling like sleepiness,
which is
and
then
dry mouth,
packaged
you
into
have to be
synaptic
feeling
vesicles. The remaining dopamine will be
like
broken down by a
polydipsia, it
class
means
of
too much
enzymes called
trust you
monoamine
have to feeling.
oxidases,
And
or
rebound
MAOs for
hypertension, it
short.
means again and again,
Now once
like
inside the vesicles,
you have
dopamine
to be
gets
shown
converted to
hypertension in the
norepinephrine.
body.
And
Clinical
then,
reasons,
whenever the
which
appropriate
time you
signal
have to be
travels
taking
down the
central
axon
acting
to the
alpha
axon
agonists
terminal,
like
these
resistance,
vesicles
HTN,
fuse
and
with the
methylodopa
presynaptic
safe in
membrane in
pregnancy.
order for
Like
norepinephrine to
methylodopa
get
is
released, or
best for the
exocytosed,
pregnancy,
into the
pregnant
synaptic
woman,
cleft
but
and
make
take
sure you
action on
have to
the
be
adrenergic
consult
receptors
to the
of the
doctor.
postsynaptic neuronal
Why?
membrane.
Because
Okay,
there is a
but
chances
this
to
release of
abnormality
norepinephrine is
caused
controlled
in
through
the
negative
pregnant
feedback
woman.
inhibition.
Also,
So when
the
a presynaptic
alpha-2
nerve
receptors
terminal is
is
stimulated to release
caused
a
the
bunch of
decrease
norepinephrine
the
in the synapse,
contractility of the
some of
heart
it will
rate
bind to a
decrease
special type
and
of
the
receptor
decrease the peripheral
called an
resistance.
alpha-2
So if
adrenergic
there are
receptor
chances to
located on
require
the
the
presynaptic
baby or
membrane.
placenta has too much
These
blood flow in
alpha-2
their body
receptors then
or like in
inhibit further
placenta,
release
so
of
all that
norepinephrine
time you
into
are
the
taking the
synapse, so the
methylodopa, so
postsynaptic
it will be
neuron doesn't
decrease
get
them.
overstimulated.
So there is one chance, and there is another chance is if the
Alright,
like
so
baby or
medications
placenta is
that
to be
act on
not
adrenergic
recommended
neurons of the
of the too
brainstem
much
to inhibit
acetylcholine or
adrenergic
like
signal transmission
sympathetic
are called
nervous system
central
activation. You
anti-adrenergics.
have been shown the body of
What
female
these
who
do
is
is
pregnant,
collectively
and there
oppose the
is a
effects of the
symptoms
sympathetic
goes to
nervous
the baby,
system.
which is
So overall,
caused
the
to
heart
any
rate
kind
and
of
blood
further
pressure
difficulties.
decrease,
So
digestive process
that
speeds up,
on
and the
that
fight or
time we
flight
are
response
stopping the
gets
medicine is
blocked.
methylodopa. So the both of the situation we have to taking the
So
medicine,
central
but make sure you
anti-adrenergics are
have
divided
to
into alpha-2
consult the
adrenergic
doctor.
receptor agonists
So that is the
and a
central
special
acting
drug
alpha
called
agonist.
methyl dopa.
Next is to be
Alpha-2
peripheral alpha
adrenergic receptor
antagonists.
agonists
So
include
you have
clonidine,
as you know about that
and
peripheral, the
guanfacine.
peripheral vessels,
These
and
medications
alpha
stimulate
agent which is
alpha-2
present
adrenergic
receptor which is present
receptors
into the
of the
blood vessels.
presynaptic
Antagonist, it
neurons in
means
the CNS,
it will be against the
especially those
action
in the
show
medulla.
into the
This
peripheral. So
decreases the
peripheral
release
alpha
of
1
norepinephrine in the
antagonists,
sympathetic
alpha
neurons,
blockers
which leads
are
to lower
drugs
blood
that
pressure.
relax
At the
smooth
same
muscle
time,
by blocking
alpha-2
the
receptor
alpha 1
agonists,
adrenergic
clonidine
receptor.
in particular,
So what is
act
the
on
mechanism?
alpha-2
So there is a
adrenergic
presynaptic
receptors
membrane, or
present
this
in a
is the
special
postsynaptic
region at the
membrane,
front of the brain
and
called
this
the
is the
prefrontal
flap. So
cortex,
alpha
where
1
they exert the
receptors
same
which is also
inhibitory
present
effect on
here,
norepinephrine
and the
release,
acetylcholine are present
moderating the amount
into
of
the presynaptic
epinephrine in this part
and
of
it
the
will be
brain
saying to the
helps
signal
tune
which is
out irrelevant
also the
stimuli and
acetylcholine
sharpens
in the form of
focus.
acetylcholine or
So
also
it's
the form
useful
of
in
the
the treatment
hormones.
of attention
So
deficit
on that time
hyperactivity disorder,
it will
or
be like
ADHD for
block
short.
them the alpha antagonists. How? Like If you are
Now, the
taking the
main side
medicine like
effect of these medications is that the
Parajosine,
blood
so
pressure
it
may
will be
fall too low and
direct
cause
bind into the
orthostatic
alpha-1
hypotension.
antagonist, and
Also, if
it will
someone
be
quits taking them
like
too abruptly,
oppose
blood
action
pressure
so
may
into
go
the
through the roof and
like
cause severe
whole of the
rebound
neuron.
hypertension
So
due
it
to
will
a
be
rebound
against
in the
axon
sympathetic
so, which is
activity.
also known as
Other side effects
alpha-adrenergic
include sedation,
axon or
fatigue,
alpha-antagonist
as
axon
well
you
as
have to install in
nausea
the
and
patient
gastric
body.
upset.
So primarily used to treat hypertension and begins
Now,
prostatic
another central
hypoplasia.
antiadrenergic
Like a
medication
patient
is
is high blood
methyl-dopa.
pressure, so on that time you have taken
Methyl-dopa
the
looks like
medicines,
L-dopa,
and
so much so that it
hypercalcia
fools
on
the
the
enzyme
patient, prostatic, so you have taken
dopa-decarboxylase
the
to
medicine
convert it to
alpha-antagonist.
methyl-dopamine.
There is two medication are
Methyl-dopamine can't
like
get broken down by
prazosin
monoamine
or
oxidases, so it
terazosine.
builds up and
So
moves into
that
the
is useful
synaptic
on that time. So
vesicles
what is the
and gets
mechanism of action?
converted to
Block the alpha-1 receptors
methylnorepinephrine.
and increase the vasodilation. If the alpha-1 receptors are
Methylnorepinephrine
bind
then
by
builds
with
up
the
inside the
alpha-agonist
vesicles
medicine,
and
which is
pushes the true
prazosin and terazosine,
norepinephrine into the
so the
cytoplasm, where they
acetylcholine
get
not
chopped up
bind
by
over there,
monoamine
and it will be
oxidases.
like
So when a signal
reuptake
comes,
and move back
methylnorepinephrine
into
is
the
released instead.
brain signals,
And
and it will be
methylnorepinephrine not only
stimulate the brain
can't
signal. Now
activate
it's
adrenergic
time to be
receptors
relaxed
of the
to the
postsynaptic
blood
neuron,
vessels,
but it
and
can circle
you
back
have
to
to be
act on
relaxed
alpha-2
like
adrenergic receptors on the
another
presynaptic
contraction
neuron
into the body.
membrane, leading to further
Effect:
inhibition of
decrease the peripheral
norepinephrine
resistance,
release.
as you have to
So
know.
methyl-dopa
Adverse
could be
effect:
given
if
to
you are
lower
taking
blood
too much
pressure during
progestin or
pregnancy,
tetrazosin, so
since
what
it's
their
safe for
effect
the
is going to
baby.
show, like first dose
In general, though,
hypertension,
it's not so
dizziness,
commonly
and
used
relaxed
due to its several
tachycardia. So
side
that is the
effects,
some
ranging from
clinical
mild
case,
ones like
like
drowsiness,
sign and
fatigue,
symptoms you have to
nausea,
insane a
and
patient
gastric
body. So
upset,
not
to pretty severe
too
ones
much
like liver
adverse, but
toxicity, allergic
not take in
reactions,
a long
and
time.
hemolytic
Make sure you
reactions,
have to
or
be
red blood
consult to
cell
the doctor.
breakdown.
Next is to be direct acting vasodilator. It
Now,
means
we want to
it
make a
directly
simple and
acting
fun
into the
mnemonic
blood
that'll help you
vessels,
efficiently
which is
memorize and
venous,
retain all
and
these
it
pharm
will be
facts.
relax them. So
Okay,
how it
so let's
directly
have an
relax
iguana
vascular
driving a
smooth muscles,
Benz for
reducing
guana
the peripheral
bends,
resistance.
and another
They
iguana powdering
target
her
the
face
arterioles
for
to treat
guanfacine.
severe
In the
hypertension.
backseat
It
is a
means it
clown
directly
for
target to the
clonidine, and they
arteries,
head down a
or it
highway
will be
lane
relax
called
them any kind
Alpha-2
of
to
resistance
remind
you
you
have
that
to
they are
be shown
Alpha-2
into the
adrenergic
arterioles.
agonists.
The
There's a
drugs names
billboard with a
are
giant brain to help you remember they act on the
or
central nervous
minoxidil.
system. In the middle
What
of
is
the
the
lane, a
mechanism of
black
action of
cat
the
trapped in a
direct
cage is
acting
drinking from a cup of cola, which
vasodilators?
represents the
So it will be
inhibition of
relaxed to the vascular
catecholamine
smooth
release.
muscle, which is
For the
heart muscle or
indications of these
any kind of
drugs, there's a large blood pressure cuff sticking out of the
veins or
trunk to
arteries.
represent
And
hypertension.
what is the effect you have to
The
install?
clown is jumping
Decrease
up
the
and down to
afterload
show that
and decrease
clonidine
the
is
blood
used to
pressure.
treat
So all of the
ADHD.
action you have to install
For the major
into the
side effects, let's use
direct
billboard on
acting
the side of the road.
vasodilator or peripheral
Zoe's sign is a
antagonists.
picture of a basketball
They
player
are
getting a
related
rebound,
to
which
same to
represents
each other,
rebound
but
hypertension. And the fans
the
are fainting from excitement
peripheral
to represent
alpha
orthostatic
antagonist is to
hypotension.
be
Okay,
bind
moving on
over
to the next
the
drug. Further down the Alpha-2 highway, there's a
postsynaptic
pregnant
membrane or
Doberman carrying a
presynaptic
slab of
membrane
meat
cleft.
for methyl-dopa,
But the
which is
direct
safe for
acting
use in pregnancy.
vasodilator is
It's bleeding a
binding
black
to
kitty
the
out of its box to
over the
represent how this medication can displace
vessels or
catecholamines from their
veins.
vesicles.
So there
For
is a
indications, let's put blood
difference
pressure cuff
of
around the
the
box for hypertension. Besides
direct
dopamine, we
acting
can shoot up liver and
vasodilator
some
or
shredded red blood
peripheral
cells,
alpha
since methyl-dopa
antagonist.
causes liver
So
toxicity
what
and
is the
hemolysis.
adverse effect? It reflects tachycardia, fluid
All right, as a quick recap.
retention,
Central
lupus-like
antiadrenergics act in the
syndrome
central nervous
like
system to block sympathetic output. They include
hydrolysine
alpha-2
and
agonists like clonidine, guanabans,
hypertrichosis.
and
It means
guanfacine,
it
which
will
inhibit
be
catecholamine release through negative
increase the
feedback control and are
heartbeat,
used to treat hypertension.
increase the
Clonidine in particular can also be
respiration
used to treat
system.
ADHD.
Fluid
There's also
retention, it
methyl-dopa,
means
which gets
too
converted to
much
the false
accumulation
neurotransmitter
of the
methylnorepinephrine,
bladder
which
of
displaces norepinephrine,
urine
but
into
also stimulates
bladder.
alpha-2 receptors.
Lupus-like syndrome
Methyl-dopa is
into the
effective in hypertension
hydrolyzine.
and
It
is safe
means
for
you are
use during
taking too
pregnancy.
much hydrolyzine medicines. It will so that
But wait, there's
lupus-like
more. Here's
syndromes
a mind map with all of
and
the
the
mnemonics. Go ahead and pause the
hypertrichosis
video so you can
you
test
have to
yourself and
install
see
in
what
the
you remember.
body.
Stay tuned for the
Which
answers after the
like
words.
clinical uses, on which time we have to be taking this kind of medicine, like severe HIN and resistance HTN, severe HTN and resistance HTN. So that is the end of the cardiovascular pharmacology. Thank you.